Hi everyone, so today I'm going to do a little bit different video. For a start, we're in a different location in the house. I figured you all maybe were tired of looking at the psychedelic watercolor painting behind me rather. I didn't really realize that my one video where I really touch on nursing, which is what's in my nursing bag video, and I'll put a link down below. It's really one of my most viewed videos on my channel. When I started my channel, I was more focused on like a vegan, vegetarian, cruelty-free journey, but just the nature of being a nurse kind of evolved into that video, talking about what's in my bag. And I had a really nice comment from a viewer who was asking for some more nurse related videos, so I thought that was actually a really good suggestion. She'd asked me to do like a vlog, which you're not really allowed to have cameras or cell phones in the facility, of course, due to HIPAA. So anyway, one that I had really been thinking about doing even prior to her suggestion was some tips for how to do a really good epic med pass. I'm not going to say where I work, but I do work in a long-term care / skilled nursing facility. I work day shifts, so I work 7 a.m. to 7 p.m. I usually don't get off on time at night. We'll get into that later. I have male and female residents. I have about 30 residents right now. I always work on the same hall every time that I work, so I know my residents pretty well. So just kind of giving you a background of kind of how my job description works. And I'm charge nurse on my floor, and I normally have anywhere between 3 and 4 nurse aides working with me, and it's usually all my same techs that I work with. Like, we all work the same days every week, so we're paired up, so we all know each other. We're like a little family. But anyway, what I really want to talk about was my med pass that I do. So the morning med pass is definitely the heaviest med pass of all time. I get there at 7. I normally don't get the keys to my med carts. That's right, plural, not 1 but 2. I have 2 med carts. The way my hall is set up, it's like an L shape, so one cart goes one way, one goes the other. So I get the keys and count the narcotics and get report from the night nurses. Depending on what they've got going on, as far as them getting wound down for the day, night, they sometimes don't give me the keys till maybe closer to 8 o'clock. So I've got like a little bit of time to kill to get myself ready, which is point 1. Get your stuff together, girl or boy. I don't discriminate. There's some good male nurses out there. Get it together. Like, you might as well go ahead and get you 3 or 4 pens. Put them in your pocket, because you're going to lose a couple during the shift, like at some point. Or somebody's going to see it laying on top of your cart and steal it. It's inevitable. Get your pens. Get your scissors, your pen light, your Sharpie. You know, the whole bit. Get it. If you have people with tubes, feeding tubes, that is, go ahead and get your stethoscope out. If you got to take apical pulse, go ahead and get your stethoscope out. I carry like a lot of extra things on my person, which I guess I could do a whole separate video on that. Pulse ox and things like that not every single nurse carries all the time. I just like to have it on me. So get that ready. And not only that, but get your cart ready. Even if you don't have the keys to your cart yet to unlock it, you can go ahead and look and see on the outside. Like, do you have your cups, your drinking cups, your med cups, spoons, straws? Go ahead and hunt down your pudding or applesauce, whatever you're mixing your crust meds in, your pill crusher packets. Go ahead and fill up your water pitcher. Get your house supplement out, which could be like an Ensure kind of based supplement that a lot of the residents get. Get your thickened liquids out, your thickened juices, and then kind of stop and think if you have any like really particular people, like, oh, Miss Smith will only take her meds with prune juice, like hunt down your prune juice, like just get it all kind of coordinated, get it situated. Go ahead and get yourself a piece of paper or some type of notepad out. So just kind of like get ready and sort of take inventory of everything. Then once you get the cart and get a report, you can go ahead and look and see if it looks like you're running low in any supplements. Usually that is something that I do forget to do because I'll be like halfway down the hall and realize I'm completely out of iron or calcium, vitamin C, and then have to go hunt for some. Which brings me to my next point. Don't let stuff eat up your time like that. It's really not in order here, but anyway, get prepped. That's my first point. Let me try to go in order because I'm really trying to simplify things because I definitely struggle with my med pass working day shift. I used to work 3 to 11 at another facility and it wasn't near as heavy, but like this morning one, like you got to be on it. So caffeinate up and get ready. I also try to grab those that are residents that are close to me, like for their medicine as far as like proximity. I don't want to say too much about where I work, but anyway, the way my nursing station is set up, there is an assisted feeder room, assisted dining room next to it. And I know you're not supposed to get your meds in the dining room. However, if state surveyors are not there, you'll learn there's a lot of things that happen differently when they're not there. So anyway, I have about, I want to say like a good, I'm trying to count in my brain, like at least like 5 to 6 residents that are in that dining room consolidated for like a good 20-30 minute chunk of time, like getting fed their breakfast. So I just go ahead and like boom, 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 like knock all them out that are in that area. And that way, like if they go to the activity room or whatever and they disperse directly after breakfast, like I don't have to worry about trying to chase and hunt them down. So I get those that are close to me, bang, knocked out. They're done. Next, I do what I call my needies, just my needy little angels, the ones that you'll find that people, even though you can tell them every single day, you know, I have 30 residents, Miss Smith, like, you know, you just have to bear with me. I'll get, you know, get to you as soon as I can. Well, can't you bring me mine first? Well, you know, one of me, 30 of y'all, everyone can't be first. Fact of life. So anyway, I try to get the people that I know are going to like really chase me down and have like a come apart. I try to get my little needies out the way. So, and some of it's not so much that they want it right early, first thing in the morning. They want it whenever they roll up to your cart. They're like, okay, I'm here, I'm ready for my medicine. And you may or may not have it ready. So you may want to go ahead and get theirs ready. Take it in the drawer on the slide. Don't let anyone catch you doing it. And I'd just be like, oh yes, I was just waiting on you to get here for your medicine. Also, as far as breakfast goes, the night shift will normally do the finger sticks before breakfast, so don't worry about the breakfast finger stick. But if anybody does need a sliding scale insulin coverage, go ahead and get that to them once their tray is in front of them, of course. The way both the nursing homes I worked at are set up, unless they're just like a super uncontrolled, like out of hand, insanity, diabetic, we don't really do the finger sticks. Just do them PRN if they're showing any kind of signs or symptoms of hypo or hyperglycemia. So that's not really a big deal. The next point that I kind of touched on earlier, no interruptions. Like, and I learned this like a long time ago from coworkers. Like, don't let anything that's like non-essential interrupt you during your morning med pass. As far as like, I don't know, like it could be anything really. You'd be surprised. Like if somebody's missing like their glasses or something like that, like you just have to say, I'm sorry, let me get these people their morning medicines. It's very important. And I will, you know, I will look for the glasses. I promise you, we will all, once we get breakfast finished, once we get these medicines passed out, we will look for the glasses. Because you'd be surprised. Like people will really harp on you, want you to drop everything that you're doing, literally, to stop and look for something like that. And you kind of have to explain to them, look, these people need their blood pressure medications. They need, you know, their cardiac medicines. Like, it's really important that they get these medicines. Like, you can't, I'm really sorry, you know, grandma will live without the glasses for, you know, a few minutes until I get this done. So what I do, though, in order to not forget all these little things that I need to do that come up, is I make a to-do list as I'm going down the line. So say somebody is missing their hearing aids, missing their teeth, or somebody, you know, has something to kind of semi-minor that they want to talk to the doctor about. Like, oh, I think I need to see the podiatrist, you know. Okay, let me just go ahead and write that down so I won't forget, because there's only so much you can cram in your brain, at least me. So anyway, and then I also grab a pharmacy order sheet. The way ours is set up, you have like the barcodes you pull off of the meds. So if they're getting low, I gotta just go ahead and start slapping that on there. If they're completely out of something, I go ahead and put it on there. I try to get it faxed over as soon as possible to the pharmacy before they make their morning run, so that way, like, nobody's, you know, you're not having to hunt for medicines later during your other med passes. Pretty much that's it. Of course, you know, take breaks if you need to, but I really just like try to like push myself. Like by the end of the med pass, like it takes from, you know, say if I don't get started till 7:38, like it takes until 11. It takes until lunchtime basically to get the meds out to them. So I don't take smoke breaks because I don't smoke, and I try to always like have some type of meal or like little bar protein shake before I get started. Sometimes like it's just really rough, like you're just dragging, it's hard, and always, you know, always ask for help. Sometimes you have a kind of like a float nurse or a float person that's like, oh, what can I help you do, you know, and you know, you can ask them to fax some things or ask them to call the pharmacy for you, just kind of, you know, and always, you know, be appreciative of that, of course. But that's pretty much my best advice for the med pass. Like I said, if you're not a nurse and this video makes absolutely no sense, you're like, what the hell is a med pass? Then I'm sorry. Maybe it sheds a little light on what I do every day for 12 hours a day, plus some more extra hours at the end of the shift. But anyway, that's basically it. Of course, you know, things are going to come up that are going to make you deviate from your plan. You know, obviously if someone's choking or someone's turned blue or someone's passed away or someone's fallen and gotten hurt, you know, there's a lot of like major things that come up during the shift that can really put a halt to all pill passing. So basically that's it. Oh, one other thing I could think of too is if someone is asking for like a pain pill or something PRN, like just go ahead and take them all their stuff. Like there's no need to like take them one pill, double back, you know. It's like go ahead and just be like, okay, well I'm just gonna go ahead and bring you that pain pill you're requesting plus all your other medicine. Just, you know, try to think ahead a little bit and save yourself some foot traffic. Lastly, I would say, what was I gonna say? Oh, I would say don't let people get really like uptight about like, oh, I've got to have my medicine right now. I mean, honestly, sure, the blood pressure and cardiac medicine, pain pills, nitroglycerin, things like that are really important, but you know, most people there are there long term and it's their home, and none of the meds that they're on are like that crucially timed where if they don't get the pill within that, you know, 5-minute span of time, they're gonna cease to take their breath anymore or something, you know. So don't let people get you so bent out of shape. And of course you can always lock yourself in the bathroom or bedroom if they're really bugging you that day. Anyway, that's it guys. I hope you enjoyed this video, and I will try to do some more nursing videos as requested. If you have any questions or comments, please leave them down below, and don't forget to like this video and subscribe. Thanks.